All right, we are at 10 a.m. on the dot and 10:01 now. And so I think we'll just go ahead and get started. I think a few more folks will be joining us as we get started here. And we will just kind of launch right in. My name is Carrie Howard, and I am going to be your facilitator for our first LOA session today. Just a little bit about me. I've been with Stratus Health for about 4 years now, primarily working on a project called the Partnership to Advance Tribal Health. And that is specifically a project with the Indian Health Service hospitals here in Minnesota and across the country. So I work really closely with the two hospitals in Cass Lake and Red Lake and with the Bemidji area office, and also support our national team. So we've got additional hospitals in the Dakotas, Montana, New Mexico, Arizona, and Oklahoma. By background, I worked for the Mayo Clinic for several years in a lab setting and learned very quickly that my actual interests lie in improvement and trying to figure out how to do things better and more efficiently. And so started getting interested in the science of improvement and the processes of improvement there. Went back to school and got a master's degree in health administration. And that then brought me to Fargo, where I worked for Sanford Health for several years, primarily serving what we called the network hospitals, so the critical access hospitals in the Sanford Health footprint. And I was a quality improvement advisor there, and that's where I actually got to know Ashley, who I'm very glad to see on this call. I got to know Ashley pretty well during that time, and so excited to see both some of my IHS friends and some of my Sanford Health friends, and excited to meet some new friends on this rural population health project over the next several months. And with that, I think, we had an intro session, which feels like it was a million years ago now. It was just before Christmas, and we were just first starting to get to know each other. And I wanted to spend a little bit of time today and kind of do another round of intros. And this time, instead of talking about how we are keeping ourselves healthy and well and sane in pandemic times, I thought it would be fun to talk a little bit about any of your experiences visiting one of the other communities in this cohort. So if you haven't been to one of the specific towns or areas, just maybe tell us close enough. I think it will help us remember who is on the call, and hopefully it will be a fun exercise as well. And with that, so I already shared a little bit about me, but I did want to share a story. So I mentioned that I used to work for Sanford Health and used to work with Sanford Wheaton, and a couple of things. I didn't explore the town a lot while I was there, but a couple things about the facility that I really like. And Ashley, you can back me up on this, but in the hallways at Sanford Wheaton, I think it was a local photographer that came in and took a whole bunch of black and white photos of the staff and the community members, and they are hung up, they line all the hallways, and they're big pictures that are framed really nicely, and they're just really cool. I like how they integrated the staff and the community, and I just love that. And the other thing I loved about visiting there is they always fed us really well. So we would always have lunch there, and they had these really good bars that were like oatmeal and chocolate bars that I think I had the recipe to them once, but I think maybe Ashley, you need to find and share that recipe with the rest of the group. And with that, I'm going to start picking on people to go next. And actually, I'm just going to invite Kim to go next.
Yeah, thanks, Carrie, and welcome back, everyone. We're really excited to get started. I'm glad you're all here. Kim McCoy, again, I'm a senior program manager at Stratus Health. I have been working with Carrie for the last few years on a project, the Partnership to Advance Tribal Health. So we've been working with the folks at Cass Lake who are on now, which I'm also really excited about to be able to continue and kind of expand on the work that we've done with them. So I made multiple trips up to the Cass Lake area for that work over the last few years and really enjoyed getting to know that whole team and a lot of, or at least some of the community members up there as well. But my other connection that I have to that community just a little farther east is I have friends who have a cabin just kind of northwest of Grand Rapids that where we go a couple times every summer, and I just love being up there. It's quiet, it's peaceful, it's in the kind of on the edge of the national forest, and so it's always just a highlight of our summer. So that's my story to share.
Thanks, Kim. And let's go to Ashley next.
All right, I am Ashley in Wheaton, and Carrie is right. We do have those pictures still lining our hallways. We update them every few years with staff changes and different things like that, so we keep them up to date. And they were bumpy bars, I believe, that you liked, or rebel bars. And I will find that recipe for you. I really enjoy going up to the Duluth Two Harbors area. We have friends that have a camper up there that we backwoods it for a while every summer. Really enjoy the hiking and all that. So that is where I like to go.
Awesome. Thanks, Ashley. Let's go to Brenda next. And Brenda, you might be on mute. I'm wondering if you are maybe the phone line. If you are talking, we cannot hear you.
And Brenda, you might have to do *6 to unmute your phone if you're on the phone.
Can you hear me?
Yeah.
All right. Can you hear me now?
Yeah.
All right. Yeah, my name is Brenda Grayden. I am the population health nurse here at Community Memorial Hospital in CMH Raider Family Clinic in Cloquet. And I actually am born and raised in the Two Harbors area. So I really love that area. It's very near and dear to my heart. And my husband and I also love to just take drives up in the Grand Rapids, Bemidji area. And that's actually where we got our dock because we live on a lake. So love all of Minnesota, but partial to the Two Harbors and then the Grand Rapids, Bemidji area.
Nice, thank you. And I don't know if I actually said it before, but I work for Stratus Health, but I actually live and work out of my home in Bemidji. So yes, I am also partial to the Bemidji area. All right, let's go to Holly. And Holly, also, if you are talking, you are still on mute. So if you're connected by phone, you might have to push *6. And sometimes you also have to unmute the actual mute function on your phone line.
Sorry, Carrie. Holly posted in the chat that she needs to find a microphone.
Okay, so. Perfect. We will come back, Holly. All right, let's go to Christy.
Hi, my name is Christy Inger. I am a care coordinator at Olivia Hospital and Clinic. And I guess out of the facilities, I don't think I've been in any of the medical facilities, but I really enjoy the Duluth area, especially some of the historic area and the bed and breakfasts up there.
Awesome, thank you. Let's go to Ellie.
Can you hear me now?
We can.
Hi, I am Ellie Morin. I'm the acting quality manager at Cass Lake IHS in Cass Lake, Minnesota. And what else was I supposed to say, Carrie?
Tell us about a time you visited one of these other areas, if you have. And if you haven't, then something close enough to one of these other areas.
I guess Duluth was one of the areas, right? Twin Harbors?
Yep.
As like visiting them in their hospitals or visiting them just for fun?
Just for fun.
Oh, we tried to hit all of the state parks in the Duluth area this summer, just because, you know, that was probably one of the safest things to do during COVID. So love the area, love all the waterfalls that we got to see. Devil's Kettle was awesome. So that was kind of nice and relaxing to get away from all of the hustle and bustle of being in healthcare.
Yeah, that sounds like a really good plan. And I feel like maybe I want to do that now.
It was beautiful.
Yeah, I'm sure. Let's go to Rachel.
Good morning. I am Rachel. I am the Employee Wellness and Community Coordinator for Lakeview Hospital in Two Harbors. I guess likewise, I haven't been to any of the other facilities, but I do have some friends in Marshall. So kind of that West Central area I like because it's totally different from the North Shore. And our friends have a farm and they also do maple syruping. So we like to kind of get into the culture down there when we visit them.
Yeah, that sounds really fun. How about Carly?
I am Carly Kubash, the clinic manager with Olivia Hospital and Clinic. I've been to the Duluth area once, but it was unfortunately a really foggy weekend for us. And we, a few years ago, went to the Bemidji area, and the scenery up there is just beautiful with all the pine trees.
Yes, again, I'm biased, but that is part of why we moved here. We wanted to be in the trees and near the water. So coming from Fargo, where it was flat and nothing, treeless farmland, we have really enjoyed being in this area. All right, let's go to Sherry.
Hi, I'm Sherry Rickamoto, and I am the clinic supervisor and the RN care manager at the Wheaton Sanford Clinic. We're very rural, so we all have a few different titles. And let's see, I've been to the Duluth area and the Cloquet, I think. I'm trying to think Cloquet. Oh yeah, we worked with a food company up there when I was in the nursing home business. Anyway, beautiful area. I always enjoyed going to Duluth. I would say when you come down the hill, it looks like you're going into a different country. So anyway,
Yeah,
that's what I got.
All right, thank you. And then let's try and circle back to Holly. It looks like it's connecting to audio, so might be able to hear you soon.
Hello, can you guys hear me now?
We can.
Ooh, wonderful. Okay, I connected a different way. Wonderful. So my name is Holly Olson. I wasn't on the first call. I am one of the registered nurses here at the clinic in Benson. We recently started our annual wellness visit program. So the population health is kind of new to our area, and that's a small part to the job that I do here. So I have been to the Olivia area, and that's wonderful. They've always been so accommodating, and we've taken a couple of trips up to the Duluth area, and that's been wonderful as well.
All right, thank you so much for sharing. And I see, Greg, you just joined, but I'm hoping that you are willing to check in with us. We are just kind of going round robin here, and you would be the last but not least to again introduce yourself, your role, your organization, and then if you have one, share a story about visiting one of our cohort communities. And it doesn't have to be about visiting one of the facilities, but it could be for fun, for vacation, whatever you want to share.
All right, good morning, everybody. My apologies for being late. I was dealing with COVID vaccine rollout in Lake County, so that's been a hot topic all morning. So again, Greg Ruberg, CEO at Lakeview Hospital in Two Harbors. I'm also employed by St. Luke's and do some coverage of Grand Marais up the shore. So I'm happy to be part of this group. I think our internal efforts are going well. And maybe Rachel covered this, but we brought that readiness assessment to our leadership team. And that was well received. We've also talked with our provider team, and I think we're on the right track and making great progress. I'll share a visit with our near neighbor in Cloquet. Rick has been a great partner of Lakeview and within Wilderness, and we've made some visits to their hospital to look at kind of design and building plans and different services. And so I think we work very close. Some of the other partners I have not been to specifically. I'm just looking on the map here, but I'll share the kind of the close neighbor visit first.
Excellent, thank you so much. And yeah, I am just really glad that you guys are all able to join us. You know, Greg, when you were saying you were doing some work with the COVID vaccine, we obviously recognize that that is front and center for everybody right now. So it's really an honor, I guess, or a privilege. I'm very happy that you guys are able to join us today, and hoping that the discussion and the content that we're going to talk about is really helpful for you moving forward, particularly in this time of COVID, just because all of this really does take a community effort. So when we're talking about population health and community coalitions, I'm fairly certain that this content is going to be really helpful for you all in those areas. And we will continue to learn and develop, of course, along the way, but just so happy to be able to share this time with you. With that, we're going to spend a little bit of time on some of the logistics for this project. So hopefully you all received an invitation. I think it would have come from Bryce at Stratus Health, an invitation to our project, our cohort's SharePoint site. And I'm just going to actually switch screen views here. And tell me if you can see now the Rural Population Health Community Collaborative SharePoint site.
I can see it.
Excellent. Okay. So I just thought we'd spend a little bit of time looking at this site and talking about what you can find where, and then hopefully if you haven't already tried to access this through the link in the information that Bryce shared, please let us know so we can make sure that we can get that information to you so you can get in here and explore yourselves a little bit. The home page for this cohort is the one that you're seeing right now. So there's a calendar and there's also some announcements and information right here on the home page. This calendar will include all of the group calls like we are having today. And so this happens to be on August, but you can go back through each month and see when our calls are going to be. You should also have these on your Outlook calendar. That would have come from Jody. But I thought it would be helpful to add them here as well. And then in the future, once we get into the actual action plans of population health and some of that support, we might have, or we will likely have one-on-one calls with each of your individual facilities. So we can add those kinds of things to the calendar as well. So just another place to help keep track of what's going on and when with this project. On this left side here, you can also navigate to meeting materials. And in here, this is where you're going to see recordings of the sessions. So we had some of the documents that we had in here from our kickoff call and some of the introductory documents, so that benefits and expectations. We've got a copy of that health assessment in here. Like I said, we'll put meeting recordings and some of that information in here. I think this right now is just the PowerPoint and not the actual recording. But we will be loading all of the meeting materials into this file, so you can go in and access those at any time. I think that will be especially helpful as you are bringing on more community members to your community coalition, so you can go back and pull resources or information, whatever you need at any time. We also have 2 additional sections here. So we've got the LOA resources. So this is kind of the phase 1 of this project. And so we'll upload the actual course content in here. And what we have right now is something that you may be particularly interested in, either opening up, downloading, printing, whatever you prefer. But this is what is going to guide our next 6 months. So this is the participant guide for the leading and organizing in action. And it's big. It's about 70 pages. So think about that when you're printing, print double-sided and maybe in black and white if you prefer. But this is the general outline and the course content that we're going to be working through over the next 6 months in kind of phase 1 of this project. And so you will see that there is a topic, and then there are worksheets. And so we'll be using these tools today and then ongoing. And we'll be working our way through this participant guide. And actually, if it's helpful, I think I can drop a link to this right into chat. All right. So if you haven't gone there yet, I think you should be able to access this document through that link that I just dropped in chat. And then there is this last section where it says population health resources. And this right now is empty. But as we move into phase 2 and we start moving from what are the basic concepts of building and supporting a community coalition, this is where we'll add some more of those population health specific tools and resources. So we're mostly going to use the toolkits and the content that is from RHI Hub. They've got a ton of information on there, and also very topic specific population health toolkits that can help you along the way. But any additional resources that we gather and share amongst this group will drop into this folder here. So with that, questions. Are there any questions? Does anybody have any questions about getting access to this SharePoint site or navigating the SharePoint site?
No questions, but I think it's a great idea and much appreciated to have one central source for sharing.
Excellent, thank you. I was hoping that it would be helpful. The other thing I should add is I believe you have access to upload as well. So again, as you're coming across additional resources, please feel free to upload and share the resources that you find as well. And if that isn't working for you, again, let us know, because we can make sure that we adjust that that accessibility for you guys as our cohort external partners as well. All right, so I'm going to actually flip back now to our PowerPoint presentation. All right. Let's go on. Oh, okay. So it says we're going to review the timeline, and that is just this slide. So we had shared this in that intro kickoff call as well. And this is just to reiterate again, we are in phase 1 of this project. So we're concentrating on building our capacity to lead community coalitions. So that is what this LOA, or leading and organizing in action content, is about. And you can kind of see the rough timeline here. We'll spend then August through October, again, going through some of the tools and resources available from RHI Hub and from other sources on rural population health tools and interventions. And then we'll move into phase 3, which is really where you guys at your facilities are actively working, if you're not already, but actively working with your community coalitions on a project of your choice, with the support of Kim and I and our Stratus Health team to help facilitate that, that conversation and that work. All right. Any questions about the timeline or anything else so far? All right. I'm seeing some head shakes, and I think then we will just move on into our content for today. So today we are concentrating on our stories, basically. So I don't know, do you guys know how to use your like the thumbs up on Zoom? Or maybe if you're on video, give me an actual thumbs up. Were you able to review the narrative, the document sheet that Kim had sent previously? Thumbs up, thumbs up, thumbs up. Okay, I was just trying to gauge a little bit about who had reviewed that ahead of time. So today we're going to talk a little bit about the narrative and the motivating vision. And we're going to talk about what it is, how it works, do a little bit of exercise in analyzing or reviewing someone else practicing this, and then also taking some time amongst our small group to work on your own public narrative. And we'll spend a little time developing and then sharing our stories. And I think I just want to start a little bit, again, if you didn't get a chance to take a look at that, that content, leading and organizing in action is really based on this basic equation. So our people plus our power is going to equal change. So as a theory of change, organizing is about equipping our people with the power to make change. And it takes up 3 core questions. So who are our people? And I think this is kind of an interesting shift in what we're used to. Normally we say, what's our challenge or what's our problem first? But in this model, we're focusing on who are our people? What resources do we have? The power component is what resources do our people have access to, and what resources do we still need to move us to the change? How do we mobilize and deploy our people and our resources to achieve our vision? So again, the first question is not what is the problem, but who are our people? And it's, like I said, probably entirely different than what you're used to. I work in the quality improvement world, and it's almost always where do we see a problem? That's where we're going to focus our attention. And this really turns that concept kind of on its head, to say who are the people and what are the resources that we have that can help us address problems X, Y, and Z. In coalitions, there are multiple constituencies. That's language that we're going to use throughout this, this course. And constituencies are the groups of people who work together towards a goal. And they combine forces and stand together to achieve an even broader shared purpose. So when we say constituencies, a lot of the time that brings like political connotation, which that's not really what we mean. What we mean is people that have committed to working together towards a shared purpose. And this first section, like I said, is about narrative. So this is really a foundational piece of this whole course content is the narrative, and how are we communicating our purpose, our mission, our goals? How are we motivating people to join us in this work? How are we keeping people engaged? And this narrative is really, really key to that. So to recruit and retain the people that we need, we create our power through the people, and we use stories. And those really just help us illustrate why they should care and why they should care about joining us in our work. So narrative plays that foundational role in engaging and encouraging others to support and join the coalition. And it's the skill of creating a shared story around common values to motivate others to join us in action. And there's three core components to this, and that's the story of self, the story of us, and the story of now. So these just really offer a framework for developing our clear and collective purpose, and creates a values-based culture that is really the foundation of the group's effort. Excuse me. The other thing that's really helpful about this is because it really speaks to people's intrinsic values and motivation, and that helps create that urgency to act and reinforces decision making. So narrative reminds team members of what it is that actually unites us together and how we can make a difference together. So a little bit more about the story of self, story of us, and the story of now. So a little bit self-explanatory, but the story of self is our personal past experiences that's used by leaders and individuals very courageously and authentically to describe our own personal experience. So whether it's trials navigating the healthcare system, or stories about our loved ones who were harmed in the course of their care, or stories about things that went really well and why they went really well and how you felt important and cared for. They tell the stories about patients whose lives could have been saved by our population health efforts if only we had been working together at that time. It tells stories like, you know, when families have been financially burdened trying to pay for care, or had been harmed by a problem with care coordination. They share personal, but also universal relatable moments of grief and loss, or again, of joy, and how those moments have transformed us as the individual, transformed me sharing my story. The story of us then is about our group. So it's about our community, it's about our workplace, it's about our coalition members. And that's where the narrator talks about, or the presenter talks about the community and how diverse stakeholders can come together to care for each other. so when in this pandemic time, people have come together to overcome community-wide crises, where people are coming together to plan community COVID vaccination clinics and getting that communication out and organizing that process of actual vaccine administration. They talk about the urgent challenges and again, how we have been better together and how we are better together and how we will be better together in the future. The story of now then is how we can continue to improve if we are working together. So it's really about ensuring that we are taking care of each other and working together, and we're working together in a way that is more effective and efficient for everybody. And this also gets into why it's important now. So what is the urgency? What is the mandate, I guess, for us to be coming together now to be working collaboratively? I want to take just a minute to kind of circle back to how different this view of narrative and this view of leading and organizing and action is than what we're used to. So again, what we're used to, and please jump in and share your comments or your thoughts about this, but in my experience, what we're used to is saying we have a problem in this area, we're going to tackle this, we've got these people available to help us with it, and we'll go from there. In this model, we're really shifting that to say, who's on our team? What skills and resources do we have? And then what problems can we address? And so I just want to take just a moment and check in with everybody and see what are your initial reactions about this model or this approach to community coalitions and collaborative work.
I'd be happy to start. I think it resonates with me. I think it's a great model, and I think the way you described it is certainly effective. What I keep coming back to is, again, probably the COVID-19 pandemic and around immunization. And maybe just because we've lived this for, I think, 18 hours a day for the last month or so. But I think specifically for Two Harbors, we rolled out a community-wide plan that really is our hospital and 2 medical clinics in really close collaboration with our Lake County Public Health Department. And I think we both brought past experiences to the table as we worked on planning our kind of integrated model for the county. We worked through our resources and I think our strengths, maybe where our limitations were, came together with a plan that we think is going to serve the county really well. And our goal was really focused on structure, clarity, and consistency, which we've not been getting from the federal and state level in so many levels. So I think clearly we're going to do better together. I think the other piece, what it's really highlighted to me, is how important this population health work is going to be for all of us as we go forward. We thought we understood public health in the county before, both from a medical standpoint and from a public health standpoint, but we have learned so many things and identified so many gaps and so many challenges that we had absolutely no idea even existed. The feedback we're getting from the public about equity and access to vaccine and medical care and broadband and transportation are all things that we knew, but I don't think they were high enough priorities. We looked at kind of the county model. So our model's far from perfect, but I think this is going to really spur a lot of growth and learning countywide. And I think this will help, this initiative will help provide some framework. So that'd be my thoughts on it.
Excellent, thank you.
And Carrie, Ellie just posted in the chat, nothing will motivate you more than a past experience, whether it was good or bad, to make a change.
Yeah, isn't that the truth? Like kind of those in-between experiences where it was neutral, nothing especially bad or good, those don't really stick with you as much as the two extremes, right? And the other thing about this too is people, in my experience at least, are more likely to turn around and retell that story to 5 more of their friends. Again, if we are using those personal stories and those experiences to say, you know, I just heard this really interesting or this really crazy story from this other person. And so, yeah, sharing our personal stories and connecting ourselves to this work is really important. So again, I in my experience, and I am totally guilty of this too, that I often am so involved in the work and the tasks, I forget about what it means to me. You know, what's my motivating purpose and vision, and why am I here, and how am I connected to this work? Because I'm really passionate about quality improvement in healthcare, and there's so many things that I want to work on, and sometimes you just get so in the weeds of the tasks, you kind of forget that actual personal connection.
Well,
Go ahead.
I think Carrie, so Ellie also posted and just said how much of the bad that shouts out more, you know, that I think it's fairly common for us to kind of shout out about the bad things that are happening, and probably less common for us to talk about all the good things that are happening. But I also think just to the power of stories. I mean, we have seen that over and over and over again in the last few months as, you know, healthcare workers, things that you all are probably experiencing regularly. We're seeing people tell those stories on national television and like at the MDH briefings, and how powerful it is for people to come forward and just talk about what it's like to care for a patient with COVID, or to see somebody die alone from COVID. And it just kind of brings back, for me, how compelling it can be to actually say those stories out loud.
Yeah, I totally agree. And yeah, it is the bad stories, the sad stories. Sometimes those are the ones that really get to you. They stick with you. They hit you right in the heart. And you know, not to say that when we are building our own stories that we should always go back to those negative experiences. But you know, more to the point that the experiences on the extreme ends seem to be the ones that motivate people the most. All right, so I'm going to do another check-in question quick. How many of you were able to watch the TED Talk, the Annie Lennox TED Talk, before today's session? I see 1 thumbs up, 2 thumbs up. Couple more. Okay. So, and a couple of not yet. No, sorry. Okay. So if it's okay with those of you that have already seen this video, I think it would be helpful for us to actually take a little bit of time to review this together. And just give me 1 second to pull it up on my screen and make sure my presentation settings are right. It is, I mean, it's only 10 minutes, but that actually feels like a really long, really long video, but it's really, really powerful. And so I want to actually make sure we take the 10 minutes to watch the whole thing. So I'm going to get this loaded up here. Okay, so first question, maybe just a nod. I see Kim and Holly on my screen. Can you see the TED Talk screen? Yep, okay, perfect, thank you. And then I'm going to hit my optimize for video. All right, and then let's try this.
I'm going to share with you the story as to how I have become an HIV/AIDS campaigner. And this is the name of my campaign, Sing Campaign. In November of 2003, I was invited to take part in the launch of Nelson Mandela's 46664 Foundation. That is his HIV/AIDS foundation, and 46664 is the number that Mandela had when he was imprisoned in Robben Island. And that's me with Youssou N'Dour on stage, having the time of my life. The next day, all the artists were invited to join Mandela in Robben Island, where he was going to give a conference to the world's press. Standing in front of his former prison cell, you can see the bars of the window there. It was quite a momentous occasion for all of us. In that moment in time, Mandela told the world's press that there was a virtual genocide taking place in his country, that post-apartheid, Rainbow Nation, 1,000 people are dying on a daily basis, and that the frontline victims, the most vulnerable of all, were women and children. This was a huge impact on my mind because I am a woman and I am a mother, and I hadn't realized that the HIV/AIDS pandemic was directly affecting women in such a way. And so I committed. When I left South Africa, when I left Cape Town, I told myself, this is going to be something that I have to talk about. I have to serve. And so subsequently, I participated in every single 46664 event that I could take part in, and gave news conferences, interviews, talking and using my platform as a musician with my commitment to Mandela out of respect for the tremendous, unbelievable work that he has done. Everyone in the world respects Nelson Mandela. Everyone reveres Nelson Mandela. But do they all know about what has been taking place in South Africa, his country, the country that has one of the highest incidents of transmission of the virus? I think that if I went out into the street now and I told people what was happening there, they would be shocked. I was very fortunate a couple of years later to have met Zaki Ahmad, the founder of Treatment Action Campaign, an incredible campaigner and activist. I met him at a 46664 event. He was wearing a t-shirt like the one I wear now. This is a tool. This tells you I am in solidarity with people who have HIV, people who are living with HIV. And in a way, because of the stigma, by wearing this t-shirt, I say, yes, we can talk about this issue. It doesn't have to be in the closet. I became a member of Treatment Action Campaign, and I'm very proud to be a member of that incredible organization. It's a grassroots campaign with 80% membership being women, most of whom are HIV positive. They work in the field. They have tremendous outreach to the people who are living directly with the effects of the virus. They have education programs. They bring out the issues of stigma. It's quite extraordinary what they do, and yes, my Sing campaign has supported Treatment Action Campaign in the way that I have tried to raise awareness and to try to also raise funds. A lot of the funding that I have managed to raise has gone directly to Treatment Action Campaign and the incredible work that they do and are still continuing to do in South Africa. So this is my Sing campaign. Sing campaign is basically just me and about 3 or 4 wonderful people who help to support me. I've traveled all over the world in the last 2.5 years. I've went to about 12 different countries. Here I am in Oslo in Norway, getting a nice fat check. Singing in Hong Kong, trying to get people to raise money. In Johannesburg, I had the opportunity to play to a mainly white middle-class South African audience who ended up in tears because I used film clips that really touched the heart, the whole nature of this terrible tragedy that is taking place that people are tending to avoid because they are fatigued and they really don't quite know what the solutions are. Aaron Motsoaledi, the current health minister, attended that concert, and I had an opportunity to meet with him, and he gave his absolute commitment to try to making a change, which is absolutely necessary. This is in the Scottish Parliament. I've subsequently become an envoy for Scotland at HIV, and I was showing them my experiences and trying to, again, raise awareness. And once again in Edinburgh with the wonderful African Children's Choir, who I simply adore. And it's children like this, many of whom have been orphaned because of their family being affected by the AIDS virus. I'm sitting here in New York with Michel Sidibe. He's the director of UN AIDS, and I'm very honored by the fact that Michel invited me only a few months ago to become a UN AIDS ambassador. And in this way, I've been strengthening my platform and broadening my outreach. The message that UN AIDS are currently sending out to the world is that we would like to see the virtual elimination of the transmission of the virus from mother to child by 2015. It's a very ambitious goal, but we believe it can be achieved with political will. This can happen. And here I am with a pregnant woman who is HIV positive. And we're smiling, both of us are smiling, because we're very confident, because we know that that young woman is receiving treatment. So her life can be extended to take care of the baby she's about to give birth to, and her baby will receive PMTCT, which will mean that that baby can be born free of the virus. Now, that is prevention at the very beginning of life. It's one way to start looking at intervention with the AIDS pandemic. Now, I just would like to finish off to tell you the little story about Avalile. This is Avalile. She goes with me wherever I go. I tell her story to everyone because she represents one of millions of HIV/AIDS orphans. Avalile's mother had HIV virus. She died from AIDS-related illness. Avalile had the virus. She was born with the virus. And here she is at 7 years old, weighing no more than a 1-year-old baby. At this point in her life, she's suffering with full-blown AIDS and had pneumonia. We met her in a hospital in the Eastern Cape and spent a whole afternoon with her, an adorable child. The doctors and nurses were phenomenal. They put her on a very special, nutritious diet and took great care of her. And we didn't know when we left the hospital, because we filmed her story, we didn't know if she was going to survive. So it was a very emotional encounter and left us feeling very resonant with this direct experience, this one child, you know, that story. 5 months later, we went back to South Africa to meet Avalile again. And I'm getting the hairs on my, I don't know if you can see the hairs on my arms. They're standing up because I know what I'm going to show you. This is the transformation that took place. Isn't it extraordinary? That round of applause is actually for the doctors and nurses of the hospital who took care of Avalile, and I take it that you appreciate that kind of transformation. So I would like to say to you, each one in the audience, if you feel that every mother and every child in the world has the right to have access to good nutrition and good medical care, and you believe that the Millennium Development Goals, specifically 5 and 6, should be absolutely committed to by all governments around the world, especially in sub-Saharan Africa, could you please stand up? I think that's fair to say it's almost everyone in the hall. Thank you very much.
Okay. So I love that video. I know it feels like it's a little bit long, but it's so powerful. And I want to spend a little bit of time talking about this video and what we just heard. And so whether in chat or if you want to unmute yourselves, let's spend a little bit of time talking about that video, and particularly thinking about the components of the narrative, the story of self, the story of us, and the story of now. What did you see or hear in this presentation?
So Carrie, maybe I can get us started. I mean, certainly the story at the last part of her presentation about the girl, Avalile, and the transformation from, the first picture to the second picture and how that happened was, it demonstrated what was important to her, but it also really, I think, just was a way to touch people. It was a way to really connect around something that everybody would agree on is a good thing.
Yeah, right. One thing that like really got me is when she was talking about the goosebumps and the hairs on her arm. Like, I don't know if any of the rest of you felt that, but I did. So it was like, yeah, just another connection to her as a person, and then to this work and this purpose. It looks like Ellie added in chat, Nelson Mandela took that experience to another level by making the change and presenting it right outside of the prison. Yeah, so I feel like this video is especially powerful because it's kind of twofold. She talks about how Nelson Mandela shared his narrative, which helped motivate her, and then she moved into what she has done and how she's activating others to join her in this work now. So I just point that out because that's going to be, again, really key in these next several months as we're talking about the LOA model and leading community coalitions, is how we want to light that fire in others so that it helps spread that leadership and that ownership of what our topic or our purpose is. All right, other thoughts? How do you feel? Did you want to stand up too?
Yes.
Yes. Yeah. Yes. Yeah. Yep. Yeah. So, the other piece of this is there's a true authenticity to the way she spoke and the way she presented. You can tell, you can see, you can feel her passion. And that is another piece of why this is so motivating to others, and why we all wanted to stand up and join the cause and start Googling what the Sing Foundation is after our session.
Another thing,
Oh, go ahead.
I was going to say is that the peer pressure. So we don't necessarily think of that as our goal, but it would have been really hard for anybody in that room to not stand up. So telling this story to a group and asking for public commitment that way brings a lot of other people along.
Yeah, that is such a good point, and it's something we're going to be talking more about later in later months and sessions with LOA, is the commitment. So the explicit ask at the end to stand up, and like you said, a little bit of that peer pressure, but she framed it as I want you to do something. This isn't just something, a nice story to listen to. I actually want you to do something. And in that case, at that point, it was stand up and then, do a little more research and join me later. But another thing to think about when we are designing our own stories is, what are we actually asking people to do? So we're talking about our own story. We're talking about why it matters to everybody. We're talking about why it matters now. But the last piece to tie in is, and here's what I would like from you. So yeah, good. Anything else? And before we move on to the next exercise. Okay. The next exercise is actually that we are going to hear Kim's story So it's shorter. It's not a 10-minute video. It's a little bit shorter, but we're gonna hear Kim present her story. And then as she's talking, be listening for these things. And I'm gonna actually leave this slide up while she's talking so that you can kind of think about the components of her story and where they all kind of fit in to the structure of the story. And if you have already downloaded or printed your participant guide, I think there is a worksheet on page 9 or 10 that might be helpful if you wanted to use that in real time. But with that, I'm going to hand it over to Kim to share her story.
Here we go. I gotta unmute. Thanks, Carrie. So maybe one thing I'll just say before I launch into my story is that, you know, this I think is a better illustration probably than the TED Talk of what we're asking you to do. So we're not asking you to develop a TED Talk with a full presentation, right? We just want you to be able to tell your own story in a compelling way. And it's one that's this is gonna evolve over time. So you know, you're going to get started today, and then you're going to keep working on it, and you're probably going to add to it and change it as you learn more. I will also just say before I start that I have this written down, so we're not saying you have to be able to recite this from memory every time. And then maybe the last thing I'll say before I get started is that I developed this in the context of some work that we were doing around care transitions and care coordination. Okay. So about 2.5 years ago, I got a phone call with the news that a very close friend of mine had collapsed in church and was taken to the hospital by ambulance. ED staff spent 45 minutes trying to keep her alive, and they did save her. This was 1 month after her 50th birthday. At the time, I was in Cincinnati, Ohio, visiting my family. By the time I arrived back in Minneapolis, they determined that she had suffered a pulmonary embolism. She was in the ICU and she was conscious, but she couldn't speak or see or walk. She could hear, and as far as we could tell, she had maintained much of her cognitive functioning. She's a nurse, so some of you may be able to imagine what it was like for her to be laying in the hospital bed, listening to the clinical staff talk about her case, but not being able to communicate with them. Over the next few months, I watched her get moved from unit to unit, hospital to rehab to home, and engage with any number of providers, surgeons, neurologists, brain specialists, eye specialists, nurses, OT, PT, speech therapy, home health, and others. I helped her communicate with providers, with insurance companies, and with her employer. Sometimes those folks had talked to each other and sometimes they had not. Sometimes they said the same things to us and sometimes they contradicted each other. Fast forward about 3 years now, she can walk with a cane. She recovered some of her sight, but she's legally blind. Her speech is better, but she isn't easy to understand. She's 53, she can't drive, she can't work. Her life is dramatically different than it was. To this day, I wonder what could have been if her providers had actually talked to each other, had planned her care together, and had cared just a little bit more about helping her get back to who she had been. This isn't to say that her providers didn't care. I've been doing this work long enough to know that the healthcare environment isn't always conducive to caring, and it doesn't make sharing information easy. But I also know that we can do better. And I can help, and I want to make a difference so that the next time this happens, we get the best possible outcome and we all feel good knowing that we and the system worked for the best interest of the patient.
Thanks, Kim. Listening to your story, like I can't help but feel emotional and to start thinking about some of the stories that I have heard or seen within my family or, for myself. But let's take a little time amongst the group and talk a little bit about Kim's story now. So what did you hear, and how did her story make you feel?
I'll share a couple of thoughts. I think it was motivating and inspiring to make a difference and actually try to do something to improve the care delivery model. She sold it well.
Yeah, thank you.
The image of nurse sitting in the bed and being unable to move or do anything kind of really got me. And you can really feel you were really there seeing that.
Yeah, right. So a lot of the visual description, like you felt it. And then too, I'm not a nurse, but for those of you that are, like that's a whole other level of knowing the system and understanding what should be happening, and like feeling frustrated or feeling like you're not in control. Yeah, that's the emotional piece. There's a couple things in chat here coming in from Ellie, that our health system is difficult to navigate through. So like just that it's, reiterating how complicated and sometimes frustrating the healthcare system is. From Ashley, she said, I heard that there was a struggle to get through all the hoops needed to care for this patient. It also made you think about personal stories and want to improve the system to make it easier. Yeah. From Brenda, she says, it was very touching. It is hard to navigate the system and all the aftercares. Yes, for sure. And again, really powerful to hear from those of us within the system, and then to think about, like, kind of taking it that next step to thinking about the patients and the people who aren't familiar with the healthcare system, how much more complicated and confusing it would be for those people. All right, other comments or questions or any other additional thoughts? Kim, what was it like to share that story?
I was just going to say that, Carrie. So it's happened, like 3 years ago now, and it still takes me right back. It's emotional.
Yeah. Yeah. And I think that's another really key point in this discussion and in this lesson is that sharing these stories takes courage. And it takes a lot of bravery. And I will just share that we've done these sessions, usually the LOA content, what we've done in the past is like a 1 or 2 day in-person boot camp. And I remember as one of the facilitators getting up to share my story, and yep, it was written and I was ready and I had written it weeks before, and I got up and I started reading it and my voice started cracking and I had to stop and like compose myself, which is not like me at all. I'm not a crier usually. My husband teases me that I'm an almost crier. So it is really, when we're talking about the things that we really care about and the people that we really love, like that is part of our emotion and our energy that reaches people. It touches people. It can be difficult for us to deliver that message, but that is part of why these stories are so powerful. All right. Any other last thoughts about Kim's example or the video example before we move on to the next piece? All right. Hearing none, we're going to go into the hard part here next. And we're going to actually spend a little bit of time within this session for you to start thinking about and developing your own story. So we're going to take, oh gosh, let's say 5 to 7 minutes for you to actually start thinking about your narrative. And so I'm going to leave this slide up so you can kind of use this as a guide. And again, if you have printed or you have your participant guide available, you can kind of use that. There's some worksheets in pages like 9, 10, I think that's the page numbers where the worksheets for this section are. And I'm just going to mute the line, and maybe I'll even find some music to play if I can figure out how to do that. I want you to grab a piece of paper. If you don't have one handy already, grab a piece of paper and actually start thinking about your own narrative. So what is your story of self? What is your call to action? What do you want people to do? What do you want them to join you in? And kind of start thinking through that. And then after we come back in, 5 to 7 minutes-ish, I'm going to call on a few of you to share. So be prepared for that as well. All right. I'll be quiet now and let you get to work. All right, we'll just give one more minute and then we'll come back together. All right. So I by no means expect that you're going to have a perfect story fully developed in 5 minutes. But I do want to spend a little bit of time, and I know we're getting close to the end of our session here today, but I just want to ask maybe one or two brave people if you are willing to share your story.
I can go first and I am specifically wanting to look at wellness and screenings in our population here. Like I mentioned before, I'm specifically working with population health and the Medicare annual wellness visit. And part of the purpose is I want to do better for our community. I want to make a positive difference in our community. Yeah, I want to make a difference, but I also want to make a positive difference for somebody. I understand that some screenings do find, you know, terrible diagnoses, but it's positive that we found it earlier than later. And kind of personal experience, you know, hearing from families, not necessarily directly to me, but the thank you. Thank you for talking me into doing that screening because you did find this. And, you know, just family experience as well. We have a cancer diagnosis within my family, and my parents were thankful for the doctor that did that or that noticed it quickly. So that's kind of what I want to focus on, and yeah, we'll kind of go from there.
Excellent. Thank you so much for sharing, Holly. Anyone else want to share a little bit about your story or what you were working on?
Can you hear me, Carrie?
I can.
So this is Ellie. Just because of the pandemic, and we struggle in IHS to find nurses and staff because the burnout's so high with being so strapped and not have enough staff to cover. So I was thinking we are working on a wellness team right now, and I'm kind of manning it, not the chair of it, but there's a few of us that feel the need for internal customer service and motivating our staff and rewarding our staff and just being kind to each other. So, I mean, the morale was kind of bad before COVID hit, and then COVID hit. So then could you imagine the hit that we've taken since then? So that's kind of the challenge that I wanted to tackle.
Yeah, thanks for sharing, Ellie. And what an important one, right? Like the importance that we all need to help take care of each other, not just our patients, but each other. Yeah, thank you. I do want to spend a little bit of time in reflection about how that went as you started writing that story, or even to those of you the couple of you that spoke up, like, what did that feel like to open yourself up to a group of mostly new friends, to share that story? Thanks, Ellie. She said it's scary. Yeah, it can be. It can be intimidating, and you get, the fear, nervousness, butterflies about it. There's a little vulnerability in opening up, and like for you, Ellie, in your story, to say things aren't going super well, and people aren't feeling very good. That can be really hard to admit. Or back to Holly's story, to say, this has happened in my family, and that when you were telling those stories about why it's important to you and why screenings are important, I couldn't help but think about one of my very good friends who, her doctor encouraged her to get a mammogram at age 40, because her mom had breast cancer. And so she did it, not thinking anything was wrong, and then had been immediately diagnosed with breast cancer and ended up having a double mastectomy last year. So, it's things like that where, had that doctor not mentioned it or encouraged her to do that screening, who knows what would have happened. The outcome could have been so much worse than, thank God, than what it is. All right, so we've only got a few minutes left. So one other thing that I did want to mention is that in your participant guide, I was just looking at that during the writing session, and in your participant guide on page 10, there's a tool, or part of the worksheets in there is for coaching. So one of your assignments going forward, and actually I'm just going to flip to the next slide because we're talking about some of the next steps. One of your assignments for our next session in a month is for, in the meantime, for you to continue working on your narrative and to practice with others. And so, if you have a team of 2, you can practice together. If you want to bring in a few more folks from your facility or from your community coalition, we highly encourage you to start engaging some of those partners. But intentionally take the time to practice that and use that coaching worksheet. So it helps kind of define, like, what should you be looking for. And when you're practicing creating these stories, this is a new skill for everybody. And so I needed that coaching and still need that coaching just as much as anybody else about how to refine my story. And so that just kind of lays out that process. And I think at the very top of it, it basically says, well, actually, let me just share it. Let me open up what it does say. One moment, please. Sorry. I'm just going to flip my screen here. Maybe. Stuck on my other screen. So let's try this. Here we go. All right. Can you see the page? This is page 10 in your participant guide. And what it very explicitly says is, don't simply offer feel-good comments like, that was really great, thanks for sharing, because that isn't true coaching. So throughout this process too, we're going to be talking a lot about coaching. But when we're practicing specifically in the context of these stories, really do try to listen for these key points and share constructive feedback, to say, there's really good examples in here. When you described this, I got a really clear picture of what you were going through, and it really connected me to my own story. And kind of work through this coaching worksheet as well. I think it's really helpful, not only in your own development, but also in development of your own story, but also in developing your coaching skills. Okay, I am going to go back to the last slide.
Maybe I'll just say,
Yeah, go ahead.
it's easier. I'm sure I can say for myself, and I think I can say it for Carrie too, that if you want to practice with one of us, like tell your story over the phone or over Zoom and get some feedback, we would be happy to do that.
Yes, thank you, Kim. Yeah, absolutely. All right, in our last 2 minutes, one thing I'm going to ask Kim to drop in just a really brief check-in question for today's session into chat. And then there are a couple of next steps. So I already talked a little bit about practicing your own narrative. So working on, further developing your own story. And then there's going to be some pre-work for session 2, just like for this one, we sent out the article and the video ahead of time. So this time you can take a look at the participant guide to the next section, which is on building relationships. And hopefully we will also have a content video available for you before our February session to review. So we can have the didactic content ahead of time, and we can spend a little bit more time in actual discussion and practice within these live sessions. And then also to, like I mentioned before, to continue identifying your community's people. So who are your partners? Who are your key stakeholders that are going to be and should be a part of your coalition? And if you have good relationships with those people and they are free, please do let us know, and we will invite them into this series. They can participate right alongside you guys as hospital, staff participants. We are very, very open and excited to bring your community partners in as well. With that, that's pretty much the end of our content. You see Kim's name and my name here, and we are going to be your main points of contact. You'll also, like I said, be occasionally receiving information from Jody, so keep an eye out for emails from Jody as well. And with that, we are right on the dot at 11:30, and I thank you so much for your time and your discussion and your participation today. I know an hour and a half in the times of COVID is a huge commitment, so thank you. And we are very excited to see you next month.
Thank you.
Thanks, everyone.
All right, thank you.
Thank you.
Thank you all.